everyone, my name is Idam Qureshi and I'm an internal medicine doctor at Bella Health and Wellness Clinic. This video is part of our Health Connect series. Every month we have a health topic that we talk to the local community about, usually at our clinic, but due to the CDC's guidelines, this month's topic will be live streamed on our Facebook page. Of course, the topic is COVID-19. The live stream will be at 5 p.m. Central Standard Time on March 25th. Come with your questions. We'll be happy to answer anything based on the data that we have at the time. You can also write your questions below, and we will also address those questions during the live stream. However, since this is a rapidly evolving situation, I decided to create this video series to educate our patients, the local community, and anybody else who's interested on the coronavirus 19. I feel that the mass hysteria in the United States that's happening right now is due to the fact that there is a lot of misinformation out there and not enough information out there. So let's start with basics. Currently, there are 162,687 cases worldwide as of March 15th. 3,244 of those cases are in the United States. 56 are in the state of Texas, and 25 cases are in the DFW area. There is a lot more information out there about COVID-19 than most people think. There is 162,687 patients that we are monitoring, and a global community of doctors that is sharing that data with each other to try to share information about this disease and to tackle how to treat this disease. So let's get started. What is COVID-19? It is a positive stranded RNA virus of the coronavirus family. So those people who are saying that the coronavirus has been around forever and this is a hoax, they're only partially correct. So this is not a hoax, this is real, but they are correct that the coronavirus family has been around for a long time. Now, COVID-19 is a new virus in that family. That being the case, there's no vaccination for it, and there is no treatment for it at this time. There are 7 viruses in that family that are known to infect the human population, including the common cold, SARS, and MERS. So if you get infected with the virus at this time, we would give you supportive treatment. That means we'll give you some IV fluids, we may need to put you on a ventilator to help you breathe, or give you any medication that might provide you symptomatic relief, like Tylenol, while your body fights off that virus on its own. Once again, there is no treatment as of right now. So, how is this virus transmitted? So there is some debate on if it is transmitted through droplets or if this virus is airborne. We know it definitely transmits through droplets. But if it's airborne, it makes it even worse. So let me explain. Airborne spread happens when a germ floats through the air after a person talks, sneezes, or coughs, and gets into other people who breathe it in. So airborne viruses include TB and chickenpox. Droplet spread happens when germs are traveling inside the droplets that you release when you cough or sneeze, and those droplets get inside somebody's mouth, nose, or eyes. There is some evidence that states that this virus can last for several hours in the air. As we are not 100% sure if this is an airborne virus or not, we should go ahead and treat it as an airborne virus. Another route is through urine and feces. COVID-19 has been found in both urine and feces samples. Therefore, please wash your hands. Another route is also through contact with infected surfaces. So if somebody coughs on a table and you touch the table and then you touch your mouth or your nose or your eyes, you can also get the virus that way. It is said that this virus can last on surfaces for up to 3 days. The most important part is, what is the mortality rate of this virus? So if you look at just the numbers that are available to us currently, We have 6,065 deaths from this virus worldwide currently. That makes the mortality of this virus 3.7%. However, you have to understand that widespread testing is not being done, and in the United States, it's simply not available. So the number of people that have that virus is probably significantly higher than what we think it is. And that brings down that mortality rate. So if you look at South Korea did do widespread testing. And if you look at their mortality rate, it's closer to about 1%, which is probably what's closer to the truth. So 1% mortality means that 99% of the people that get it will survive this. So this is not a death sentence. There is no reason to panic as much as we are at this time. There is also, if you look at this graph, an age-related component to mortality. So mortality does go up as you get older, which is why we are more concerned with the elderly population as this virus spreads. The COVID-19 resource website by Johns Hopkins is an excellent resource to track the spread of the virus and to keep an eye out for new news on the virus. If you go to the interactive map, it gives you the breakdown of total cases, deaths, and recoveries by country. So let's talk about how do we protect ourselves. First and foremost, of course, wash your hands for 20 seconds with soap and water, especially after going to the restroom, preparing or eating food, and every time you're coming in from somewhere. Remember, you don't know what's happened outside of your house. You might not even know what's happened in your house if you have kids or pets. Avoid touching your eyes, nose, and face. I know this is easier said than done. All of us like to touch our face. But if you touch your eyes, nose, or face, go ahead and wash your hands immediately afterwards. Wipe down your commonly used products with CDC-approved list of products, which I will link below, such as your cell phone, your laptop, the buttons on your shirt, your doorknobs. If you need to sneeze or cough, do so into your elbow, or better yet, into a tissue, and then throw that tissue away immediately. Practice social distancing. So what does that mean? It means to stay away from large gatherings. So if you were planning on going to a show, this is probably a good time to not go there if it hasn't already been canceled. Maybe not going to your local church, mosque, or synagogue. Rescheduling any non-essential travel or doctor's appointments. So this virus did spread mainly through travel. Every 20 minutes in an airplane, the air recirculates. So if somebody on the airplane has the coronavirus, you will be exposed to it every 20 minutes. Also, staying away from doctor's offices is a good idea at this time because sick patients are going to be there, and there are probably many that will be infected with COVID-19. If you don't need to go to the doctor's office, don't. However, if you are sick, it's best to call your primary care physician and find out what their directions are if they need you to go to an urgent care, an ER, or if they need you to go to a local facility where they're offering COVID-19 testing. Stay away from people who are sick. I guess that's a no-brainer, but that would be a good idea right now. If you are sick, please stay at home. Do not show up to work. Don't go to your local Starbucks. Don't go out to the movies. Don't flood the emergency department or the urgent care centers. Once again, we have limited capacity in this country of hospital beds, and you don't want to overwhelm the system like what has happened in Italy. And also, please don't hoard supplies. There is a national shortage of personal protective equipment for healthcare providers right now. If your healthcare providers get sick or they start dying, who's going to take care of the patients? So if you are one of those people who went and bought 1,000 masks, I would encourage you to please drop them off at your local urgent care, ER, or hospital so that the people who truly need them can use them. And there's absolutely no reason to hoard toilet paper or groceries that you're not going to use. You should be making them available to everybody. This is a country of 327 million people. So let's talk about why social distancing is so important. If you look at this graph, you can see that the trajectory of the virus by different countries. As you can see, cases in Hong Kong and Singapore leveled off very quickly, despite the amount of tourism that they have, because of early testing, quarantining of individuals with the virus, and shutting down schools and local public events. Unfortunately, we're more on the same trajectory with Italy, where 250 people died over a 24-hour period yesterday. Even with the lockdown, Italy has been unable to flatten the curve. And if we don't do something about it now, we're just about 10 days behind them. Italy overwhelmed their healthcare system, and that's why they're in the situation that they are now. And we are about to do the same thing. So please follow what your local health officials and the CDC are telling you, and stay safe until the next video. Bye.